Hello again. Here we are in the studio to talk about the satellite symposia of today's program. All of you had the opportunity this morning to follow the Asahi Symposium about current trends in musculoskeletal embolization. I hope you all enjoyed that. But there is much more for today. So I will start with Dr. Florian Wolf here from Vienna and ask him about his preferences for the symposia today.
I definitely have preferences today. I have two sessions that I will definitely be there. First of all, Cascination. I don't know if you heard about this system. This is a very nice Swiss company doing guiding for robotic ablation procedures. And we had the chance in the last weeks to have this machine in our department. We do ablation procedures with MRI, with microwave since many, many years. And I was really skeptical when this machine came to us because I can do it without any guiding normally. But after 10 patients, I'm really convinced, and you will see this in this very nice session here. First of all, you will hear a little bit about the evidence of these procedures. And second, I'm really looking forward to hear Dr. Berman from Stockholm. They did 1,000 patients, and she will report about this really great experience with this technique. And last but not least, a new part of this Cascination technique is the ablation. This is some kind of quality margin assessment and quantitative margin assessment of your ablation procedure.
Yes, I think it's very important for everybody to understand that ablation has much better results. There are some papers talking about that when our needle is navigated exactly in the right position because no matter how experienced the interventionalist is, sometimes you have to choose your own axis, but if you choose it, the navigation system can place the needle much safer, exactly to the point, and it's shown that in these cases, the margins, the ablation margins around the tumor are better, so you have less reoccurrence. Is that right?
Definitely, and moreover, you can avoid dangerous structures on your way to the target. And you can use all kind of imaging to do the planning of the procedure. For example, you can do a CT with contrast before, you can do an MRI and put it all together with your imaging, with your recent CT imaging, normally without contrast media. And it sounds complicated, but at the end it's really simple. You just plan your procedure, you take your needle and you push in with one stitch into the patient into the ablation area.
Some people really think, oh no, I don't need it. I'm too good for that. So, but there are some advantages.
Definitely.
Okay, what else for today?
Second, Sirtex. It sounds a little bit boring because we heard it since many years and we know this company since many years. But I think it's really important, and when you read the title, Real-World Evidence for Shear Spheres and Opportunities for Improved Outcomes, I think the word evidence is so important because when you talk with your oncologists, for them evidence is everything. You can have the best procedure in the world and you go to your oncologists and you don't have any evidence. They say, okay, nice, but we will not do it because there is no evidence. So we will hear 4 talks, one welcome and then 4 talks talking about evidence and how evidence can be brought to this very important therapy.
Very nice. Thank you, Florian. Now we move to my friend Mohammed Hamadi from London. Mohammed, what are your hot topics for today?
Well, I mean, there are several interesting symposium today, but the one of them that it's close to my heart and also my practice is the drug-eluting. We heard a lot in the last few days about the drug-eluting technology, and the enthusiasm and the skepticism and concern run parallel to each other, and the debate is out there. We are the CIRSE interventional radiologists. We are at the cutting edge of new technology and innovation. That's unstoppable. That's the sign of our meeting this year. And I'm really looking at this new generation of the drug-eluting technology from a company, Alvimedica, the Nitides or Nitides. So it is a new generation of drug-eluting technology. So I'm really keen to see what does that involve, what's the evidence so far, and how can this, if possible, to implement it in the practice and study it.
Yes, I think many years ago the problem was to get access to those occlusions or stenosis, then to repair them, and then the drug-eluting stents were a great opportunity for better results, long-term results. And then we had concerns about safety of the patients, and now there was a big discussion in the last years, and now I think the empire will strike back. So with new technologies, safer for the patient.
Yes, I think we as professional special intervention radiology, we are always coming with something new, advancing new technology, but also we should be in a position to appraise those new technology properly and provide the best evidence all the time.
Yes, it's really crucial for us in our society and our professional what we do. We are working together with industry and technology. They provide us with what we need according to our needs. We discuss with them first, then they propose a product, or we create with them together a product, or we change the product accordingly, and then they come back and we try it again. And this is how research and clinical work improves.
Absolutely.
Okay, thank you, Mo. Now we go to Professor Robert Morgan from London. And Rob, what do you think about today's satellites?
Well, a session that caught my eye is the Medtronic Symposium on safe sedation, new standards of practice in interventional radiology. And of course, this is a topic that affects us all. We use sedation and analgesia in all the procedures that we perform. There are 3 talks in this session. The first is entitled Risks and Potential Complications During Procedural Sedation. Very important topic. Then the next talk highlights the recent standards of practice document written by several authors from CIRSE on analgesia and sedation. So this is an excellent document. I may be biased to say that, but I think this would be a key part of this session. And then finally is a really interesting session on handling respiratory compromise, a virtual simulation session. So I'm looking forward to seeing how that's tackled in this symposium.
Yes, I'm also very interested in this symposium because safe sedation, this is for better patient comfort. And if the patient lies comfortably without much pain, this is good for us because we have to work more. It's easier for us to work with them and concentrate on the procedure. If the patient doesn't feel well, first of all, this makes things worse for us. And secondly, they go then back to their home and they say, oh, it was painful. They complain. They don't feel comfortable with us. But if they had good time with us, and a good result, of course, they will spread the good word. Yes, very important. Thank you, Rob. Now I have, to my left, I have also here Professor Raman Uberoy from Oxford, and he will talk us about another 2 very interesting symposia.
Yeah, thanks, Adam. So something that's very, again, close to my practice and my heart is aortic diseases, and Bentley have got this really interesting program looking at firstly CIRAB and how we can deal with complex, difficult aortic disease, occlusive disease, and how we can improve outcomes in these patients. And using covered stents is now becoming increasingly frequent for this particular problem. So I'd be really interested to see what the data is and how that is actually working. We use it, of course, and we've been using Bentley stents for a long, long time, but getting some real hard facts and data in terms of technical and clinical outcomes is going to be really important. And then, of course, there's the use of the Bentley stents in emergency settings, and of course in complex EVAR and fenestrated and branched stent grafts, where this is probably where it's being utilized a lot, and we use it certainly in our practice. And it's now coming onto on label. It's been off label for many years. So this is really an important evolution, and the stent has changed in design, of course, over that time, has become more robust and better. And so again, this is something that I'd really like to find out a little bit more about. As I say, we use it, but I think it's something that, getting some more background data, and I think Florian alluded to this before, in all our practices, it's really important to have some good sound background knowledge of how to use these devices, but how effective they are, so that we can really get the best outcomes for our patients. So this is a session that I'm really looking forward to.
There is also another one, which is more or less of general interest from Siemens Healthcare.
Yeah, so Siemens have got a really interesting session. This is looking at the future horizons, but actually it's technology that's here now. So this is stuff that really could help us to develop and improve our catheter labs to get great imaging so that we get the best outcomes. This means, CT guidance for carrying out precision surgery for us, getting the needles and the devices precisely to where we want them and quickly and as safely as we possibly can. So this is really, really important. And then, of course, having the simulation and virtual reality as well, and augmented reality, to try and help us get real-time imaging and potentially overlay to position, again, our catheters and devices is going to be so incredibly useful. Whichever practice you work in interventional radiology, whether it's oncology, whether it's peripheral, whether it's patabiliary, GI, it is going to be so incredibly useful. So again, this is one I'm really looking forward to.
Great. Rob, do you have any experience with augmented reality in IR?
No, but I'll certainly be logging into this session and seeing what they have to tell me.
Me neither, so I'm really very interested in watching that. And there is also information about new imaging possibilities and things about our future. You have experience with these new sophisticated systems?
Not with the Siemens, but I have experience with the augmented reality, and we had a couple of publications, and it is a developing field. It's extremely important for the training, and especially we use that for our trainees in London, especially during COVID time, and proved very useful. But it is developing, and I'm sure we can advance it further.
Yes, I think for teaching centers, this can be very important.
It's used across the Atlantic for patients, but we use it for training, and it can be used for both clinical and training.
Thank you, Mo. Florian, what do you think about that?
I think it's really important. I had the chance 4 weeks ago to go to LNN and to have a first look at this needle companion, and it's really fascinating, and I really tell you, go to the session and have a look there. Moreover, I think that virtual reality will be the future for us, and for example, for training, to do a procedure firstly in a virtual reality world. I have such a goggle at home, an Oculus system, and it's crazy when you put in your head, you're completely in another world. You can go to the ISS, you can play games, whatever, and you're completely away. Yeah. So I'm really looking forward having these techniques in our daily work.
Great. Thank you very much for this information. I hope our colleagues enjoy all this symposia, and I wish to have a very nice afternoon. Thank you very much.